Let's talk about healthcare. Two plans with the public option have been voted down. The Max Baucus plan is, for lack of a better term, going absolutely nowhere. We know what happened in 1994 to Bill Clinton and Hillary Clinton in terms of healthcare reform. It was not good. Nothing happened. For lack of a better term, it was a dud. It was a failure. It was a null and void attempt at doing something positive with healthcare. And Bill Clinton was recently on Meet the Press, and he was asked, do you worry about a repeat of 1994 politically with healthcare?
Do you worry about a repeat of 94 politically?
There's no way they can make it that bad for several reasons. Number one, the country is more diverse and more interested in positive action. Number two, they've seen this movie before because they had 8 years under President Bush when the Republicans finally had the whole government, and they know the results were bad. And number three, the Democrats haven't taken on the gun lobby like I did, and they took 15 of our members out. So I don't think it'll be, whatever happens, it'll be manageable for the president.
I hope he's right. But I'm telling you, Lewis, I am increasingly discouraged by what's going on with healthcare at this point. We talked the first few months of Barack Obama's presidency about what's going on with healthcare. Obviously, it is absolutely the number one issue in the news right now, where it's not even clear whether anything else will get done by government. Significant. Of course, government continues to move until something is resolved here. And I'm not convinced that there isn't going to be not the exact same thing that happened in 1994, but the exact same end result, which is nothing happens. Absolutely nothing happens.
Well, at least from a PR standpoint, or if the majority of Americans feel that there needs to be some type of change, I think ultimately something will change.
It's possible, but it may even change for the worse. I really have zero confidence at this point. And what's unbelievable is that this public option thing that has basically been completely knocked down. It's questionable at this point whether it's even on the table, honestly, after what happened in the last 48 hours with two public option amendments plans voted down. The public option is the biggest obstacle to healthcare reform, and more people believe in UFOs than those that oppose the public option. And for whatever reason, it's almost impossible to get this public option through. Not almost impossible, it has been impossible to get the option through. A recent New York Times CBS News poll found that 65% of Americans favor a public option. Now, I know the emails I'm going to get. That does not say that 65% of Americans favor getting their current private insurance taken away. That's not what the poll asks. Does the poll ask whether people favor death panels? No. All the poll is asking is, do you favor having a public option in the list of what is available to you for healthcare? And 2 out of 3 people say, yes, we do. To put that number in perspective, in a 2007 AP poll, 34% of Americans believe in UFOs. So you'll have an easier time, Lewis, by quite a bit, finding people that believe in UFOs than you will finding people that think that there shouldn't be a public option. And for whatever reason, it is impossible to get this through, no matter what is said by Barack Obama, no matter what facts are presented, no matter what the level of the case is being made, that it will not make it so that you have to give up your current plan. It's amazing. It really is amazing.
Well, maybe it's just too much too fast. I mean, maybe we need to start, like we talked about earlier, with smaller things. Maybe expand, Medicare 5 years.
It's too late. Barack Obama blew it, though. It's way too late for that. I on Twitter, there was a discussion going on. I mentioned last week we talked about this, and I said Barack Obama from the start should have said, you know what? We're not going to have a public option. We're not going to have whatever buzzwords, whatever message, whatever the media people have assigned to this. What we're going to have is we're going to have a test scenario where Medicare and Medicaid will be expanded. You can be 60 years old and qualify for Medicare, and you can make up to whatever amount and qualify for Medicaid, and let's test it. It's essentially even more than a public option. It's actually a government-run plan, and if it goes well, it would be such a strong case for the fact that the government can run this. Now, if it doesn't go well, it's pretty bad.
Right.
It's pretty damn bad if
But
it
it's a
doesn't go well.
It's a government-run option that's already in place.
Right. We're only expanding it and letting more people take advantage of it. It's too late for that. I don't even know if it's worth mentioning on this show any further because I think Barack Obama spent the political capital, for lack of a better term.
Perhaps, but if the public option just doesn't happen, then what do we do? I mean, do we go back to that?
Well, that's the question.
Or do you
what
just
happens
start
next?
making small changes in the medical system to try and save money and whatnot?
Many politicians subscribe to the incrementalist view, which is let's just do anything that gets us closer. And I don't really know. I don't know. I think there's a huge problem right now. I don't know what's going to be able to be done. And I fear that we will get to what Senator Kay Bailey Hutchison said, which is we can't mess with healthcare right now. We've got 2 wars. We've got a bad economy. Let's just do what's good. Let's leave it at the status quo. And that would be a disaster, I think.
Well, I don't know if I'd call it a disaster, but it certainly would not be progress.
It would not be progress at all. And as we know, the thing is, I think it would be the opposite of progress. We would be regressing because costs keep going up.
Financially, yes.
More and more people are uninsured. So I think doing nothing is actually moving backwards on this.
Perhaps.